Здравствуйте, скажите, пожалуйста, меня слышно, видно или нет? Можно написать в чат. Спасибо.
Да, видно, слышно.
А остальным не слышно?
Я все выключил.
Так, давайте попробуем еще раз. Ань, скажите что-нибудь.
Всем добрый вечер.
Вот, отлично. Мне вас слышно, я думаю, что всем остальным, наверное, тоже. Так, хорошо. Тогда наш план работы на сегодня следующий. Наш план работы следующий. Сначала я читаю вам 4-ю лекцию, она достаточно короткая, а потом Анна представляет статью, которую она прочитала, для вас разобрала, и у нас есть возможность эту статью обсудить. Хорошо, а я тогда перехожу на английский. Good evening, dear students, dear colleagues. This is the 4th lecture of our Student Scientific Society, which is devoted to a part of scientific article, to the very beginning of the scientific article, and it includes title, background, which usually ends with study hypothesis and research question. So, there is no need to conduct a study without reporting the results of the study. That's why it is the aim of any researcher not only to conduct the study itself, but also to choose some way to tell everybody about the results, especially if the results are important for clinical practice. So almost any study is associated with writing of at least study report, or better, writing the article, which will then be published in some journal and read by many people, readers, researchers, clinicians, and students. So basically there are two ways of writing the article or the study report. The first way is when you just conduct a study, the whole study, and only after completing the study, after finishing it, you sit and write down what you've done and how, and what are the results. So this is when you write after the study is complete. Another way is to do these processes parallel, that is, you write the report together with the article. And this will shorten the time before the publication, because by the time you finish the study, you will have the article almost completed. Okay. If you choose the second variant to make these processes parallel, then you will be able to write the first part, title, background, and study aim, as soon as you conduct your literature search, some preliminary literature analysis, and when you formulate your topic, your research question, and study hypothesis. That is when you can sit down and write the title, at least a working title, not the finalized, background and study aim. So while you develop the study protocol, you can already write materials and method section. While you conduct the study, get the first result, and conduct statistical analysis, you can already write the results section. And when you finished with the results, you can come to writing discussion, that is, compare your results with the literature that you have found. And after all this analysis, you can write the conclusion, fill in the reference list, and somewhere near the conclusion and reference list, there lies the time to write an abstract of the article, but we will devote special time for discussing the abstract. Okay, you have seen already this scheme during the previous lecture, I guess. So today we will focus on two main parts. First is title, which should tell your readers what is it all about, what is this article about, and it should be brief, informative, and easily searchable. Easily searchable, it's very important because your aim when you write the article is to tell everyone about your results. That is, you want your article to be found. You want it to be discovered by others. That's why title is very important. Many searches are performed solely on title. Another part, which we will discuss today, is the introduction, which can have different names in different journals. It may be introduction, background, rationale. There are different names. The idea is mainly the same. The idea is answering the question, why did you decide to conduct your study? That is, what is the problem? What problem you would like to solve? Is it important, and how important it is? To whom? Then what is already known on that problem, and what is still unknown? And how you will fill this gap in the knowledge by your research. And the introduction usually ends with either aim or objective of the study, or hypothesis. So they are mainly similar, but there are some differences, minor differences. Okay, and first we will look at the title, of course. As you understand, the title should summarize the main idea of the study. And a good title is really, really short. So it contains the fewest possible words. But these several words should be enough to describe what is the contents and purpose of your study. So it should be brief but informative. And also, it is considered that a good title should include the following items: the purpose of the research, the aim, the type of the research, in vitro, in vivo, clinical, which type of clinical, and the methods used, at least partially. The title can be of many types, but here I would like to tell about the working title versus final title. So the working title is the one that you choose at the very beginning of the research, and it helps you to keep focus of the study on what you initially intended to study, to assess. It is not the same as the final title, because the final title is actually created after you have done everything. And while you conducted the study, there might be some changes. You might have changed something in the methodology, maybe in the population that you've studied, and so on and so forth. So the final title should be very, very accurate concerning what exactly was done. So you see the characteristics of a good title. So first of all, as I have already mentioned, it should indicate accurately the subject and scope. Another important thing is that it should use current terminology from the field of the study. This is done mainly for search purposes, so that everybody who is interested in the topic was able to find your article, because the search is conducted using keywords. So your title should use the current terminology, so the one which is popular now. And also, I hope you remember mesh terms, that it's standardized terminology for different databases. So that title should be current. It should also identify all key variables, both dependent and independent, which are studied in your article, in your study, and maybe even suggest a relationship between these variables, although it's not always possible. Again, it should be quite short, 10 to 15 words. It is better not to include such words as a study of, analysis of, because it makes the title too long. And when the title is so long, you forget about the beginning when you reach the end. So it's not good for understanding. And most commonly, the titles are in the form of the phrase, but sometimes they may be formulated as a question. However, it is important not to make a mistake when you formulate it as a question, so it's better to consult some native speaker. And of course, you should avoid abbreviations and jargon, because they make the title difficult to understand. So let's look at some common mistakes. The title might be too general. Then, if it's too general, the better way is to make it more related to your topic, more specified. Here is the example. Imagine you see the article which is termed halitosis or bad breath. So halitosis is very general. Although you can understand from this title that the study is related to halitosis or bad breath, you have no idea on whether this article is about observational study, for example, about some prevalence, or about treatment. Maybe it's a randomized controlled trial, or in which groups. So you have no clue. That's why it's better to specify the title. And here are two examples. For example, prevalence of halitosis in different age groups, or factors related to halitosis in elderly people. So from these titles, you can understand what is the type of the research. Both are observational studies, and which group they study, elderly, for example, and different age groups. So it's more specified. Another common mistake is when the title is too long. For some reason, Russian people like to make titles so long. Look at this example. Assessment of the clinical effectiveness of complex treatment of inflammatory periodontal diseases with the use of means having a pronounced antioxidant effect in young adults. So it's so long, you cannot catch the main idea. This can be formulated in a different way. Efficiency of antioxidant therapy in young adults with gingivitis. It's quite more clear now. You can understand what is it about, not reading it for 3 times. One more common abbreviation. Title contains mistake. Title contains abbreviations. So you should not use abbreviations unless they are very, very common. So the example of very common abbreviations which you can use is a DNA. Everybody understands what is it. So look at the example, please. Outcome of RC obturation by worm GP versus CLC, a meta-analysis. Well, maybe you can guess that RC obturation is root canal obturation and GP is warm gut aperture, but CLC may be quite tricky. What is it? It's actually called lateral compaction. So avoid using abbreviations. So we've talked about the titles, the signs of good title, and common mistakes. Now let's switch to background or introduction. So this is the first section of the article after the abstract, and it should provide the context to the information which will be discussed further. So the main question which the background or introduction answers is why you conducted the research. So it should clearly state the reasons for conducting the study. It will discuss problem statement, rationale, and at the end there will be a research question or research hypothesis. What about the advices? Background should be brief and relevant to the study. It should not be too long. In the background, you should state the main problem. You may tell what is the disease or condition about. For example, I have written several articles about vertical root fractures, and almost every article started with a definition. Vertical root fracture is fracture which originates in the root, and so on and so forth. So you should state the problem. What is the problem about? Then you usually give a broad context. What is known about this problem? For diseases, a very common thing is to describe how prevalent is this disease, what are the known risk factors and populations, what are the common treatment methods if your article deals with the treatment. Then you usually proceed to something that is still unknown. So if I give you an example from my articles, it will be vertical root fracture is such type of the fracture. It happens in up to 30% of teeth which were endodontically treated. And then something that is unknown. That is, we still don't know how effective is cone beam computed tomography for the diagnosis of vertical root fractures because the data from previous studies are controversial. So after that, you usually clearly state the objective. The example may be, in our study, we aimed to assess the accuracy of CPCT for the diagnosis of vertical root fracture in such population, and so on and so forth. It's very important to cite literature sources in your background. A good idea is to cite every second sentence. So every second sentence should contain citations. So let's look at the example. This is a background from the article, which reads comparison of warm vertical compaction and cold lateral condensation of alpha and beta gut aperture and Resilon on apical extruded debris during treatment. Okay, so first, this background states the problem. The problem, it is marked in red here, that debris containing root canal filling materials, dentin, microorganisms, and irrigants may be extruded from the root canal during treatment. And this can cause inflammation, flare-up, and so on and so forth. So this is the problem, debris which causes inflammation. Next, there is some brief information about what is already known. Different materials and methods may be used for obturation. Gut aperture is the most common one because it has some good qualities. As an alternative, there are some synthetic polymer-based materials like Resilon, for example. And they are used with such techniques. So that is what is already known. Then, what is already known according to that debris. The previous studies generally compared the effects of various retreatment systems and materials on the amount of extruded debris during retreatment. Then there is a gap in the knowledge. What is unknown? The authors state that to their knowledge there have been no studies comparing the removal of root canal fillings performed with beta and alpha phase gutta percha versus Resilon. That is, what is still unknown. And я знаю, что он сядет, я уже отключила видео. And then there goes the study aim. The present in vitro study was performed to evaluate the amounts of apical extruded debris removed from root canals filled with two techniques using two-phase gutta percha, and so on and so forth. So this is the aim, to assess, to evaluate. And finally, there is a study hypothesis. I will tell you a little bit later about study hypothesis. Now just look at it. The null hypothesis was that the amount of apical extruded debris would be unaffected by the filling technique or material used. Just remember these words, null hypothesis, and that it is unaffected. We will discuss it slightly later. Here is another example, orthodontic debonding and tooth sensitivity of anterior and posterior teeth, a prospective clinical trial. A very good title. We understand that this trial is prospective and clinical. We understand that it deals with sensitivity after debonding of orthodontic appliances, and that anterior and posterior teeth are studied. Good title. Brief, concise, and informative. So what is the background? You see, it's quite short, very short. First, there is the statement of the problem. Pain. Pain is one of the most common negative factors for orthodontic patients because activation is painful, and even debonding, removal of orthodontic appliances is painful. So the problem is pain. Then, what is already known? Different stages of the fixed orthodontic therapy cause alterations to the enamel surface. Yes, there are some alterations, but something is still unknown. The degree of tooth sensitivity after debonding has not been investigated specifically. That is what is unknown. Then, there is the purpose of the study, to evaluate whether increased tooth sensitivity occurred immediately and after 7 days after debonding, and where there is some difference between anterior and posterior teeth. It's quite logic that anterior teeth might be more sensitive than posterior teeth, in which the thickness of enamel is greater. And again, we have a hypothesis here. And there are even several hypotheses. The first null hypothesis was that there would be no significant differences between pain immediately and after 7 days after debonding, and between two groups in which debonding was done in different types. And the second null hypothesis was that there would be no significant difference between anterior and posterior teeth. Okay, so again, example of a good background, quite short and informative. So what characterizes introduction in general? It goes from the general to the specific. That's why it is commonly depicted as a triangle, inverted triangle. So you start with very general things. So you put the problem into the context. And then you point out the gap in the knowledge, what is unknown. Finally, you tell how you will resolve this problem, how you will address this problem, how you will find out something using your research. Another way to describe the introduction is funnel. Here is the example from psychology, not from dentistry, but I think it's quite understandable. So imagine there is some article which tells about which studies gender inequality in primary school. Then the author would probably start with such wide topic as gender inequality in the workplace in general. Then come to gender inequality in some workplaces where female dominate. Then coming to gender inequality in the educational sector, which is obviously an example of workplaces where female predominate. And finally, it will end up with gender inequality in the primary school education. So this is mainly the first paragraph. The first paragraph of your introduction should start off with a very general description and finally come to a more specific description, a funnel structure. Then, at some point of your introduction, you will need to make connection between the existing research and your particular research question. For that topic, there are some very useful phrases, just several examples. For example, if you would like to address some overlooked aspect of your topic, you may use such phrase as, although something has been studied in detail, insufficient attention has been paid to some particular part of this something. Or if you will build on something suggested by a previous study and you want to explore it in a greater depth, then you may use the phrase, the second one, the implications of X study deserve to be explored further. And when you will present some new position, when you will depart from the consensus on the topic, from what is generally accepted, you may use the phrase, it's generally assumed that, however, this paper suggests that it's different. Okay, if you will need, I can share with you the link to Manchester Phrase Bank. So Manchester University started initiative when they summarized all possible phrases for different purposes in writing the article. So Manchester Phrase Bank, the bank of phrases, is very useful when you write the article. If you need, just contact me, I will share the link with you. So, as I have mentioned, the introduction usually ends with research question or study hypothesis or aim or both. So the research question is actually a specific question, specific inquiry to which you would like to find a question response. And it is the very, very core, the most important part of any research, because it helps to build materials and methods, to find literature. So it's in the middle, in the core, it's the heart of any research. Study hypothesis is some statement about the outcome which you expect in the study. So study hypothesis is what you expect. Research question is usually formulated according to so-called PICO or PICO-T criteria. So this is an abbreviation, and each letter stands for something. For example, letter P stands for population or problem. Letter I stands for intervention. This may be treatment, exposure to some factor, prognostic factor, or even diagnostic test. Then there is letter C, which stands for comparison or control. This may be another treatment, placebo, or negative control, that is no treatment at all. So basically you can also list the slides, but I ask you not to do that. Please do not list the slides. Okay, do not switch the slides. Letter O stands for outcome. This is the result of the intervention, by which you will assess, is intervention or control better? Please do not switch the slides. And here are some examples. First, good research question. Is home bleaching associated with less sensitivity compared to in-office bleaching in patients with external tooth discoloration? What is the population here? Patients with external tooth discoloration. What is the intervention? Home bleaching. A control comparison, in-office bleaching. And the outcome, which you are interested in, sensitivity. Another example. Does interdental brushing decrease bad breath in older male adults? So here you see population, older adults, males. Then you have an intervention, interdental brushing, and an outcome, bad breath. There is actually a comparison or control. It's not stated, but when it's not stated, it is usually a negative control, that is, group in which no treatment, no intervention was undertaken. Okay, PICO questions may differ depending on the study type. If the study type is observational, that is, it assesses prevalence of the condition or its severity in different groups, and it may be used to determine risk factors or causes of some disease or condition, then the PICO question may slightly differ. Here is the template and the examples. Are elderly people with severe periodontitis more likely to have bad breath compared to those without periodontal disease? You can find the same components of PICO here. You can find population elderly people. You can find exposure here, severe periodontitis, no exposure, no periodontal disease, control, and outcome bad breath. Do people who smoke have an increased risk of oral cancer compared to non-smokers? Again, you have population, just people, any, who smoke. Smoking is an exposure. Non-smokers is control group, comparison group, and oral cancer is an outcome, the presence of oral cancer. If this is an RCT, it's easier. So the previous examples are about RCTs. Here you can see other examples. In people with gingival recession, how does diode laser affect teeth sensitivity compared to desensitizer? So we have population, people with gingival recession. We have intervention, diode laser, and we have control, comparison, desensitizer, and outcome teeth sensitivity. And similarly, is MTA more effective for dentinal bridge formation after partial pulpotomy compared to calcium hydroxide? So again, population, people to whom partial pulpotomy was done, intervention, MTA, comparison, calcium hydroxide, and outcome, formation of dentinal bridge. For diagnostic accuracy study, it's very similar, but I becomes D, that is diagnostic test. For example, in people with endodontically treated teeth, is CBCT more accurate in diagnosing a periapical lesion compared to orthopan tomographic image? So here we have population, people with endodontically treated teeth, control test, OPG, index test, that is test of interest, CBCT, and outcome, periapical lesion. Similarly, in people with fixed orthodontic appliances, is transillumination more accurate in diagnosing proximal caries compared to bite wings? Again, people with fixed orthodontic appliances are the population, transillumination, the index test, test of interest, bite wing is a control test, and proximal caries detection is outcome. And in survey studies, we can also formulate question according to PICO. Do dentists prefer CBCT or OPG in diagnosis of apical periodontitis? So the population of interest here is dentists. CBCT and OPG are intervention and control, and the outcome is the diagnosis. And another example, are young patients more likely to entrust to artificial intelligence compared to elderly patients? And we have patients as a population, young as a population of interest, and elderly as control, and their trust to artificial intelligence is the outcome. Finally, a very interesting concept is a study hypothesis. So, as I have mentioned, hypothesis is a statement about the relationship between the variables which you are going to study. It should be specific. It should be testable, that is, you can be able to test it. And hypothesis is when you try to predict what will happen in your study. Usually it's based on the results of the previous studies, and actually it does not have to be correct. It just should be there. You can either confirm your hypothesis or not. And there is some difficulty in understanding of two concepts: research hypothesis and statistical hypothesis. So a research, please don't switch the slides. So research hypothesis is just what you expect. Is what you believe will happen in your study basing on the previous research. But statistical research is something very, very different. It needs restating the research hypothesis so that it could be tested with different statistical tests, statistical techniques. And usually two statistical hypotheses are formulated. So-called null hypothesis, which is usually denoted as H and the 0, and alternative hypothesis, which is usually denoted as H and 1. So the null hypothesis is a statistical hypothesis that should be tested, and null hypothesis is usually that there is no difference, there is no influence, any observations are just purely from chance. So null hypothesis, почему-то у меня отвалился. Null hypothesis is usually opposite to the study hypothesis, to the research hypothesis. And alternative is alternative to the null. It may sound really difficult, but if you look at the example, it becomes more clear. So, for example, you want to make suppose that smoking is a risk factor for lower exam scores for dental students. That is, students who smoke get lower marks on the exam. This is your hypothesis. Maybe it is based on some previous research that smoking affects brain activity or something. Then your null hypothesis will sound like the average exam scores of smoking and non-smoking students do not differ significantly. That is, smoking does not affect exam score. It is generally accepted in statistics that null hypothesis is that nothing is different, nothing is statistically significant, and nothing is affected by the factors. And alternative hypothesis is that the differences in the average exam scores between smokers and non-smokers are statistically significant, that actually one of this group has lower marks than the other. So when I showed you the examples of background earlier in this lecture, there were null hypotheses at the end of these backgrounds. So they stated that there is no difference. This is because this is a statistical hypothesis, not a research hypothesis. Of course, if the researchers would suppose that there are no differences, they probably would not conduct a study. But null hypothesis requires such strange statement that there are no differences at all. Okay, so good research hypothesis, not statistical one, is based on the results of previous studies, can be tested, and includes two variables, dependent and independent variables. Independent is risk factor, treatment, diagnostic test, whatever, which has some effect on a dependent variable, which is an outcome. Example, smoking increases the risk of oral leukoplakia. So smoking is an independent variable. Effect is that it increases, and an outcome is oral leukoplakia. Another, desensitizers help to reduce teeth sensitivity after in-office bleaching. And here we have some independent variable, desensitizers, a dependent variable, teeth sensitivity, and interaction. Desensitizers reduce teeth sensitivity. These are the examples. So here are more examples. For example, too many words example. Do smokers have an increased risk of oral cancer compared to non-smokers? If you have such research question, then the hypothesis which you will choose, research hypothesis, is smoking increases the risk of oral cancer. Then question, is MTA more effective for dentinal breach formation after partial pulpotomy compared to calcium hydroxide? Then the hypothesis is that MTA leads to more rapid formation of dentinal breach than the control calcium, and so on and so forth. In the end of the introduction or background, you usually do not state the research question, but you state the hypothesis or the aim of the study. So that's all for this lecture. And today we have also, я, наверное, перейду на русский. Также у нас сегодня есть выступление для журнального клуба. Пожалуйста, не листайте. У нас сегодня будет представлена статья, название ее на картинке Effects of Resinous Monomers Used in Restorative Dental Modeling on the Cohesive Strength of Composite Resin. Это исследование было проведено в университете Сан-Пауло. Здесь есть фотография кампуса этого университета, и ниже представлены те люди, которые проводили исследования. И почему я их вставила в лекцию? Потому что я хотела обратить ваше внимание. Там есть студент. Даже не один, а целых два. То есть исследование проведено каким-то практикующим врачом, двумя преподавателями, да, что примерно соответствует доценту у нас, associate professor, и двумя студентами. И оно было опубликовано вот в этом журнале, Journal of Adhesive Dentistry. Я думаю, что вообще нужно всем, кто будет дальше готовить выступление для журнального клуба, включать вот такую часть, которая рассказывает именно о журнале. Я пока это сделала сама, потому что у нас было не очень много времени. Этот журнал, издательство «Квинтэссенция», наверняка вы такой знаете, у него достаточно приличный индекс цитируемости Site Score 3,6, это достаточно много для стоматологии. И если мы посмотрим на центиль, обратите внимание, 89-й. Кто помнит, какому квартилю соответствует 89-й процентиль? Ну, наверное, я сама скажу. Первому. Это первый квартиль. Все, что выше 75, 75-го процентиля, это все первый квартиль. То есть это очень приличный журнал, в котором смогли опубликоваться студенты. Хорошо. Сейчас я включу презентацию Анны Александровны. Анна.
Да, я здесь, меня слышно?
Да, вас слышно. Пожалуйста, я тогда свой микрофон пока выключаю. Вы можете листать, верно?
Я не знаю, сейчас попробую.
Мгм.
Вот так, да?
Да, да, верно.
Мгм.
Всё, хорошо, пожалуйста, тогда вам слово.
Мне нужно включать видео?
По желанию. Хотите, можно включить.
Хорошо. Всем добрый вечер. Мы сегодня будем разбирать эту статью. Статья «Влияние моделировочных смол, используемых в реставрационном стоматологическом моделировании на когезионную прочность композита». Когезионная прочность – это прочность сцепления между композитом и композитом. Адгезионная прочность, например, это прочность сцепления между, например, тканью зуба, например, эмалью или дентином и композитом. То есть в данном исследовании мы будем смотреть именно между композитом и композитом. Целью исследования была оценка когезионной прочности между слоями композита при выполнении определенной техники. Вот аббревиатура этой техники RDMIT. Мы постарались ее перевести на русский. Это техника реставрационного моделирования зубов с использованием моделировочной смолы между слоями. В чем ее преимущество? В том, что она упрощает технику работы с композитами, внесением их в полость благодаря использованию смолы, адаптации композита в этой полости. Или, например, если мы вводим композит с помощью силиконового ключа, тоже использование смолы облегчает нам это. Также преимущество этой техники в том, что она помогает нам при восстановлении крупных полостей, например, полостей 4 класса, переломов, потому что если у нас будет какой-то сложный зуб, то с помощью техники послойного восстановления мы сможем добиться эффекта, приближенного к эффекту настоящих зубов, то есть с помощью того, что мы будем сочетать различные композиты, то есть, может, даже различных марок, различных цветов, чтобы приблизиться, ближе сделать реставрацию похожей на настоящий зуб. Вот. Сейчас. В данном исследовании выбрали 6 видов смол и взяли контрольную группу, то есть без смолы. Первое, 5 видов смол и контрольную группу. Первая группа у нас была, вот тут в табличке в первой части мы можем увидеть название, и во второй части строение, то есть состав. Вот. И, собственно, группа 2 это был вот первый композит Wetting Resin. Вторая группа у нас была CNV Liquid. Это все смолы были. И последние 3 группы у нас это адгезивы были. Вот Scotch Bond, Single Bond и Prime Bond. Почему эта табличка сюда вставлена была? Потому что они различаются составами. Scotch Bond, он без растворителей, в нем только органические компоненты, это без ГМА, гема. Вот Single Bond, он содержит водно-спиртовую основу у него, и Prime Bond, он на основе ацетона. Соответственно, как они проводили исследования, то есть материалы и методы. Была изготовлена специальная тефлоновая форма, вот мы можем ее увидеть, она была из 2 половинок. Вот сейчас на картинке она собранная. Я не знаю, тут можно подключить курсор? Видно?
Да, видно.
Ага. Вот, и, собственно, они наполняли с помощью послойной техники без смолы первую половинку, затем вторую половинку, и на границе как раз наносили смолу и отсвечивали. Далее это все собирали, и все это уложили в металлическую форму для того, чтобы это все проверить на растяжение. Вот пример оборудования, на котором проводилось это испытание. До того, как это проверить, они заполнили форму и опустили ее на 24 часа в воду. И эта конструкция находилась в теплице, как бы при 37 градусах. То есть, Нина Евгеньевна, меня хорошо слышно? У меня просто показывает красное.
Да, слышно.
Вот. И, собственно, как бы они собрали 2 формы тефлона, положили ее в воду, и вот эту вот коробочку они хранили в теплице при 37 градусах 24 часа. И только после этого они положили ее вот в металлическую форму и потом в машинку. Вот. И далее они были испытаны. Вот, испытание было на прямое растяжение, и оно использовалось для оценки прочности сцепления на границе раздела композита. Вот. Они регистрировали силу разрушения в миллиамперах. И потом вы записали эти значения. Чтобы узнать, были ли различия в каждой группе, использовали 2 теста. Тест ANOVA и тест Тьюки. Я понятно объясняю? Может быть, у кого-то есть вопросы? Угу. Ладно. Вот.
Не уверена, что если с телефона подключать, там удобно включать микрофон, мне кажется. Поэтому частично нет вопросов.
Может, если у кого-то есть, есть, я понятно рассказываю, можно написать в чат, понятно или нет, плюс или минус. Я могу объяснить, может быть, я не очень понятно доношу свою мысль.
Ну, давайте пока продолжать, если вопросы появятся, тогда будем на них отвечать уже.
Да, хорошо. Вот, собственно, первый тест, который они провели, он показывал нам, есть ли, в принципе, разница между группами, между образцами, и там было 2 переменные. Первая переменная это была зависимая, это сила сцепления композита между собой, а вторая переменная это была, собственно, вариабельная, тип смолы. И этот тест показал нам, что различия есть. И так как различия есть, нужно было сравнить уже каждую группу с другой группой, то есть взять уже по 2 группы сравнить, попарно. И для этого использовался следующий тест. Это был тест Тьюки. И он уже позволяет сравнивать сравнивать группы попарно, то есть между собой. И, собственно, в результатах мы получили в таблице значение теста Тьюки уже. Результаты. При оценке силы сцепления композита тест ANOVA показал, что между образцами различия были. Группа 4, как мы видим на табличке скотч-бонд, он имел статистически наиболее значимо высокую силу сцепления. Вот это вот, собственно, сила сцепления и отклонение от среднего значения. То есть они взяли результаты, которые получили, узнали среднее значение И далее посчитали по каждому из них отклонение от этого среднего значения. Итак, таким образом выяснили, что четвертая группа Scotch Bond имела самое большое значение, самое высокое отклонение, самую высокую силу сцепления. Остальные группы у нас получили вот такие значения. Как мы можем увидеть, контрольная группа получила наименьшую силу сцепления. От контрольной группы практически не отличались шестая группа, вторая группа и пятая группа. Вот. Результаты. Это только что то, что я зачитала. Группа 4 показала статистически значимо более высокую силу сцепления, чем контрольная группа и группа 5, группа 6. И между группой 3 или 3 и 4 значение было не такое большое. Вот. Но все-таки 4 показало самое высокое значение. Дизайн исследования. Это исследование было инвитро, искусственное, то есть не на...
Лабораторное, да, лабораторное.
Лабораторное. И актуальность. Я думаю, что эта статья актуальна, если мы используем ее, используем саму технику послойного восстановления в нашей практике, то есть, например, для прямых реставраций. Если мы используем смолу для облегчения ведения скульптурирования композита. Ну и победитель этого исследования есть у нас на кафедре, и мы им пользуемся все-таки в своей практике.
Отлично. Я думаю, что мы не будем спрашивать, потому что у нас как-то плохо с обратной связью, и просто сразу же озвучим, да, какие мы с вами решили есть минусы у этого исследования, да, ограничения.
Да, у этого исследования есть ограничения. Первое ограничение то, что это исследование... Так, я прошу прощения. Первое ограничение то, что исследование инвитро. Второе ограничение то, что оно не учитывает другие параметры, то есть это усадку, влияние на цвет композита, краевые, образование краевых микроподтеканий, долговечность, другие физико-химические свойства композита. И все-таки мы не смогли повторить условия, которые у нас есть в полости рта. И использовался в исследовании один композит Венус, компании Венус. Вот. Можно было бы также использовать, возможно, другие композиты, потому что, по-моему, в России он не такой известный.
Очень замечательно. Я хочу от себя сказать, да, что Аня сделала очень большую работу за очень короткое время, да, буквально за какие-то несколько дней она разобралась и со статьей, и с методами исследований, и с методами статистической обработки. И это очень здорово, при том, что это всего лишь 3-й курс. Я думаю, что все еще впереди вся научная деятельность, все прям впереди, все в ваших руках. Спасибо большое за такой замечательный разбор. Я не вижу вопросов здесь. Я думаю, возможно, может быть, будут какие-то вопросы там в нашей WhatsApp-группе. Я хочу... Прям вот если можно было поставить 5 за что-нибудь вам, я бы ее поставила куда-нибудь. К сожалению, у нас не оценивается участие в кружках как оценками. В любом случае, это очень полезно и для вас, и для всех, кто внимательно послушал и разобрался в исследовании. Думаю, мы можем с вами теперь похожие исследования прям планировать и проводить. Спасибо большое. Вот. Я хочу напомнить тем, кто записан дальше, у нас еще 2 человека записаны на следующие даты, что тоже неплохо бы начать подготовку этих статей и представлять их также качественно, также подробно и доходчиво, как это сделала Анна. Так, есть ли сейчас какие-то вопросы, если вы можете их задать Анне или мне? Казим, как же так нет вопросов? Такого не бывает. Ну, ладно. Давайте тогда нашу встречу будем завершать. Мы, в принципе, с вами в час уложились, как я и планировала. Еще раз огромное спасибо Ане. Она у нас еще один первопроходец, как и Дилара. И мы с вами встретимся через неделю. Также будет небольшая лекция и будет представление статьи для журнального клуба. Спасибо большое всем присутствующим. Вопросы в чат можно кидать в WhatsApp. И до встречи через неделю. Спасибо. И до свидания.